my name is Sandy Gerosa, and I'm an occupational therapist. An occupational therapist focuses on maximizing a patient's independence in activities of daily living, and that would include bathing, toileting, dressing, and homemaking skills. An occupational therapist is a member of the therapeutic rehabilitation team. Frequently, the rehab team has to employ a variety of devices and equipment in order to improve a patient's physical mobility. Today, I'm going to discuss supportive and positioning equipment, orthosis, and we're going to take a look at a lower extremity prosthetic device. First, let's discuss what the definition of supportive equipment is. Supportive equipment are devices used to help maintain or improve body posture or alignment. Let's now turn our attention to supportive bed equipment. The first piece that we'll be looking at today is a blanket cradle. As you can see, the blankets are suspended with the cradle, and the purpose of the cradle is to help remove the weight of the sheets and blanketing from the feet and ankles of the patient. In a patient that has severely impaired mobility, that is, they have difficulty rolling from side to side or repositioning themselves, even the weight of a tightly tucked under blanket can create problems for heel breakdown and sores because they feel they actually cannot move. I'm going to remove the blankets now and show you the frame of the cradle. This is just one type of blanket cradle. There are others that have brackets that are attached to the mattress, and there's a tension wire that goes over the sides, and over that the blankets are placed to help take away all the weight of the patient's, off the patient's feet. Now we're going to turn our attention to what an A-frame is. An A-frame is a foam rubber wedge used on patients right after a hip replacement surgery. It is held onto the patient with straps that are loosely closed, because if you pull the straps too tightly around the patient, you'll cause more swelling and pain. It's used to help a patient maintain their total hip precautions, and that would mean no crossing of the knees, no trunk flexion, no sitting up past 90 degrees, and no rotation of the hips. Let's now look at some heel supportive equipment. On the patient right now, we have a bunny boot. A bunny boot is held to the feet with a series of Velcro straps. The purpose of the bunny boot is to help prevent heel sores and skin breakdown on the patient that is less mobile. As you can see, this came off in two pieces. It's applied on the wedge in such a manner. It's made with a sheepskin type of material that's very soft and cushioning to the patient. And this particular bunny boot has some lateral supports which prevents the patient's hip from rotating side to side. Often a bunny boot, or as we shall see, a heel suspension boot, is used in harmony with the wedge, because as the patient is immobilized virtually by the wedge, there's a constant pressure put on the heels. So let's turn our attention to a heel suspension boot. It's composed of a complete foam rubber exterior. There's a little supportive pad in here that's adhered to with Velcro, and there's a hole in the boot where the heel is actually suspended and kept off of the mattress. I'm going to put this on our patient. It's actually very comfortable, patients have told me. And this too is held on with a series of Velcro straps. And again, they should not be pulled tightly onto the patient, because this could cause added edema and swelling and pain. It should also be noted that in your immobilized patient, the foot of the bed should be elevated when the patient is in bed in order for the edema to run, swelling to run toward the body. We're now going to take a look at a trapeze. A trapeze is a piece of equipment positioned over the bed that the patient uses their arms to help pull themselves up and reposition themselves, again, when they have severely impaired physical mobility, and rolling side to side is very difficult for them. It's seen most frequently in hospitals, but also frequently with patients that have had a hip replacement. We're now going to look at a couple of pieces of equipment that are used on the wheelchair for positioning. and they would include a variety of bolsters and bedrolls, but for our purposes today we're just going to be discussing two because the number of pieces of equipment for positioning are so vast that we're just going to focus on two of the more commonly used. This is called a lateral support bolster. When it's closed, it makes a round formation with the Velcro, like a bolster would be, and it's used on a patient that has decreased trunk control. That is, they tend to lean one side or another. It's fashioned around the wheelchair with the Velcro straps. I have the other one on our helper today already, and it shows that it holds the patient firmly in place. So if they tend to lean one way or another, it'll give them that extra support required. Another thing that we frequently use is a towel roll to make a bolster. You can use one towel, two towels, you could use a blanket roll, and we generally just use mastic tape. Again, if a patient tends to lean from one side to another, instead of the little bolster, if it's more of all of their trunk leaning rather than just the shoulders, this can easily be placed on the leaning side of the patient to help hold them more securely in the wheelchair. At this point, we should also mention that if a patient has moderately or severe trunk control problems, a variety of wheelchairs can be used and will be issued by the therapist. They include names of devices such as ortho chairs, Jerry chairs, high back recliners, and again, this is just a small sampling of bolsters that can be made and used. We're now going to turn our attention to orthosis, but first I'd like to give you a definition of what an orthosis is. An orthosis is a device added to a person's body to support, position, or immobilize a part, to correct deformity, to assist a weak muscle, and restore function, or to modify tone. We're going to be looking at some wheelchair positioning orthotic devices, starting with a hemi-tray. A hemi-tray is made out of a hard plastic material that's easily cleaned and should be kept clean for the patient, PRN, or what that means, as needed, not just reviewed in the morning or when it's taken off of the wheelchair at night, but to be reviewed periodically through the day. Warm soap and water will clean it. There's a bracket underneath that fits into the wheelchair armrest that we're going to slide on right now. And it's used to position the patient's upper extremity. It also helps, little back, there we go, helps increase their trunk control somewhat too. This is used primarily with a patient that has sustained a stroke and has no functional use. That means they have no movement of their upper extremity at all. This is an excellent piece of equipment that we use routinely with stroke patients. We're going to be looking at a second positioning device now, called a trough. It rather resembles a trough. Again, it's easily cleaned and should be kept clean for the patient, and it slides in like manner onto the wheelchair. Before we position a patient's arm into the trough, it should be all the way back to the wheelchair. We'll frequently use a piece of Dyson. It's a tacky back, easily washed piece of material. There is no front or back. And what that does is it holds a towel in place so that the patient's arm will not slide forward, since they have really no control over that arm or active movement. And then the arm can be positioned such. However, in many stroke patients, they run the potential of having a lot of swelling in their arm, and to have it in this flat manner may help their trunk control, will be a good position for their arm, but it does not help with swelling. So very frequently we add a foam rubber wedge. The flat, the back part of the wedge, goes against the back part of the trough.